Vaccine camps like this one have become the new normal as India readies to roll out the HPV vaccine in its public immunization program. The focus of the HPV vaccine, aimed at preventing cervical cancer, will initially be teenage girls between the ages of 9 to 14. And in camps like these, being run by civil society groups, the smiling faces of the girls capture the enormous hope and possibility of this moment. One woman in India dies of cervical cancer every minute. In 2023, 80,000 Indian women died from cervical cancer. And India bears 1/5 of the world's cervical cancer cases. Cervical cancer caused by the human papillomavirus is the only cancer that is preventable, and yet till now ignorance and apathy has stopped lives from being saved.
It has to be promoted on the same strategy like COVID vaccination. When the COVID came, all media supported it, everybody supported it, papers supported it, teachers, everybody supported it. So I think the general public also knew exactly the same what the doctors and the medical fraternity knew about it. So I think the government has to become serious, the public has to become serious, and without their seriousness, we will not come to know. When you talk about HPV vaccination, everybody thinks of HIV. And, they can't correlate. So I think, it has to go to the schools, it has to go to the colleges, it has to go to every housewife. We have to do lots and lots of work.
Now, as the government prepares to bring tens of thousands of HPV vaccines into the public health system, it has to first build capacity and train frontline workers. This training is not so much about administering the vaccine, but about busting myths and fake news around it.
मैडम, ये टीका सुरक्षित है ना?
जी हाँ, ये टीका अत्यंत ही सुरक्षित है। बचपन में अन्य कई टीकाओं के जैसे यह भी बहुत सुरक्षित है। लगभग 100 देशों में लाखों बच्चों ने ये टीकाकरण किया हुआ है।
You might wonder why doctors themselves are being trained instead of grassroots ASHA workers who typically drive India's mass vaccination programs. And it boils down to whom families trust. Satapa Biswas of the Cancer Foundation of India explains that their research revealed a surprising insight. While many people turn to the internet for information, they trust their physicians the most. 5,000 physicians are now enlisted for the special HPV vaccine training module.
Our job is to make sure that the vaccine is talked about to prevent cancer. That is a precise reason why we are working on this. This particular training is an online training, and the entire thing is virtual. These are structured modules which are prepared with the information, so almost about like 2.5 hours of training. And this involves role play also. These gynecologists, most of the time, you'll find them that they are into treatment mostly. Prevention is not one of their core areas of work. So you will not find them getting into preventive work very, very often, barring a few, of course. Some of them are extremely committed, but not all. So this is also for the first time, we pulled them into prevention big time.
We meet one such doctor who has just been trained and is now training other doctors and health workers.
Very interactive sessions. People really wanted to know about the vaccine, though all of them are gynecologists, all of them, but still they had many questions. We ourselves had many questions. So it was very interactive and very interesting. And later on, after the first 2 online sessions, we also had physical training sessions, which was again equally interactive. And people wanted to come. Sometimes we have so many academic programs, people try avoiding them. But in these programs, I saw the gynecologists themselves wanted to know more and more. So they came in large numbers and we had very successful training programs.
The Rotary Club of India has already vaccinated 25,000 children across the country, including in remote villages. But the next steps in India's fight against cervical cancer will need a national push. In 2020, India accounted for 23% of the world's cervical cancer deaths. In 2025, there is a real chance to change that and save thousands of lives.